Hi, I'm Lindsay Cox, Senior Manager for Advocacy and Outreach at HFA. This month's Dear Addy question comes from Anxious About Insurance. Dear Addy, I know that open enrollment for 2022 health insurance began on November 1st, 2021. As a person with a bleeding disorder, what do I need to know, and how should I go about choosing my options? Signed, Anxious About Insurance. What a great question. I know that there are so many other people that are wondering the same thing. You are right that the open enrollment just began. Open enrollment is the period each year when health insurance plans, or HMOs, health maintenance organizations, are required by law to accept applications from new plan enrollees regardless of their health history. This also is the time when you can choose to stay with your existing health plan for the coming year, if it still meets your needs. Open enrollment dates vary depending on the state you live in and whether you get your insurance from your employer, an ACA marketplace, or another source. But for many people, open enrollment takes place annually in the fall. If you get your insurance through your job, check with your human resources department to find out when your company's open enrollment period begins and ends. If you get your health insurance through the ACA marketplace, please note that in most states, the 2022 open enrollment period will run longer than in past years, November 1st to January 15th, 2022. However, in order to have insurance in effect as of January 1st, you must sign up by December 15th. For people with Medicare coverage, open enrollment runs from October 15th to December 7th. Enrollment in Medicaid for those eligible is open 365 days a year. Now let's talk about costs. Don't just focus on your premium costs. Your out-of-pocket spending, which includes deductibles, co-pays, co-insurance, and more, can end up being substantially more than your premium. Make sure you understand and compare out-of-pocket costs. If shopping on healthcare.gov, don't be put off by the list prices. Most purchasers will qualify for tax credits that lower the cost of premiums. With tax credits factored in, many people qualify for insurance that costs less than $10 a month. Depending on your income, you may also be eligible for assistance with your out-of-pocket spending, so long as you purchase a silver tier plan. When reviewing potential health plans, read all plan provisions carefully. Check that your providers are in-network, research whether your products are covered, and beware of copay accumulator adjusters. For a comprehensive list of questions to ask as you review your plan options, see the following resources below: HFA's Open Enrollment Guide, NHF's Personal Health Insurance Toolkit, and HFA's Dear Addy posts between October and December. If you cannot answer these questions, seek help and clarification from your company's Human Resources Department for employer-sponsored health insurance plans, your HTC social worker, or an ACA marketplace navigator if you are selecting a plan via the marketplace. Here are some special considerations for the 2022 plan year. As you approach open enrollment this year, it's more crucial than ever that you carefully research your options. A federal law enacted in March 2021 makes ACA insurance more affordable for those who can buy their own coverage in 2022. Under the 2021 American Rescue Plan Act, premium subsidies for 2021 and 2022 are more generous and are available to more people, even those who previously earned too much to qualify, reducing the cost of coverage for people who buy ACA insurance. Beware of skinny plans and insurance lookalikes that don't provide adequate coverage. Short-term plans, association health plans, fixed indemnity plans, and healthcare sharing ministries are good examples of these. These types of plans do not provide adequate coverage for people with bleeding disorders. They do not have to cover all ACA mandated benefits, and they do not have to meet ACA financial protection standards, leaving you at risk of huge out-of-pocket costs. You cannot get subsidies to help pay your premium costs for non-ACA plans. Make sure your plan meets ACA standards for coverage and financial protection. And don't be duped by misleading sales pitches or lookalike websites. To avoid pitfalls, start your search on www.healthcare.gov. Try to avoid health plans that limit your ability to make use of manufacturer copay assistance programs. Health plans with copay accumulator adjusters do not credit manufacturer copay assistance towards your overall deductibles or out-of-pocket maximums, leaving patients on the hook for out-of-pocket costs up to their yearly maximum. Unfortunately, it can be hard to spot whether your plan contains an accumulator adjuster. Read your plan documents carefully and call plan administrators to ask specific questions. Learn more about accumulator adjusters in this recorded session from HFA's 2020 symposium below. A reliable resource for information on open enrollment for the 2021 individual insurance plans can be found below, and a detailed set of FAQs, including many in Spanish, can also be found below. Please be an active participant as you consider your insurance options for 2022, and whether you choose to keep your current health insurance or to enroll in a new plan, read your policy. This is critical because the health insurance plan you choose will be yours for 12 months, unless you have a qualifying life event that allows you to switch plans. For questions or comments on open enrollment, please contact the Policy and Advocacy team at advocacy@hemophiliafed.org or find more information at the resources below. As always, we enjoy getting questions from the community, so please keep them coming. Submit your questions to us at dearaddy@hemophiliafed.org. Thank you.